What's up, psychologists? Welcome to my video on the topic of hypochondria. Hypochondria affects approximately 0.1% or 333,300 people in the US alone. Although it is quite rare when compared to the general populace, it still affects a large amount of people. So, what does hypochondria look like? For this portion of the presentation, we will be following James Smith, a made-up 27-year-old hypochondriac with medium symptoms. On a normal day, James wakes up at 8 a.m. and immediately heads to the bathroom. He works a 9-to-5 job at the bank as a small business manager. James brushes his teeth for at least 2 minutes before checking his face for any strange moles or patches of skin. He then proceeds to examine his mouth and throat for any other sores or concerning lumps. During his last doctor's appointment, he had the doctor examine a small gray patch on his gums, which the doctor stated was merely a burst blood vessel. Although declared safe by the doctor, James still had his doubts, as during his own research to self-diagnose, he discovered that a gray patch in the mouth is also a symptom of oral cancer. This underlying possibility of oral cancer led him to recall a few moments when he experienced other symptoms such as difficulty swallowing or chewing due to a sore throat he had contracted a few weeks ago. He also noted that he started to feel a slight numbness in his mouth shortly after reading the article. As James gets ready for work, he takes a variety of supplements such as vitamin D and vitamin E pills before packing a lunch of vegetables for the beta-carotene content. These are all micronutrients that help prevent cancer according to the research that he had done. While driving to work, he feels a slight pain in his wrist and wonders if he's developed a case of carpal tunnel syndrome. James works as a small business manager because he does not like large crowds and prefers to work with people individually. During his shift, he sometimes talks to customers about certain diseases that he may have. His favorite customers are the MediPlus pharmacy owner and the Suplaflex owner, as he can discuss numerous health-related topics. By the way, I made these companies up, so they're not real. But they're a pretty good brand name if you want to take them. After work, James makes a trip to his doctor, Dr. J. N. Hyde. As per usual, there seems to be nothing wrong with James, and the doctor recommends that he see a counselor for cognitive behavioral therapy, or CBT for short. 2 weeks later, and 4 doctor's appointments later, James shows up at the Happy Time Wellness Center. The counselor in question is Evelyn Jones, who is certified in cognitive behavioral therapy. This is also a form of psychotherapy. So, what does cognitive behavioral therapy entail? Your average CBT is going to consist of 6 to 20 sessions of developing skills and strategies to stay healthy. It's based off the CBT model. This model is based around a two-way relationship between thoughts, also known as cognitions, and behaviors. It focuses on the influence that they may have on each other. For this model, there are 3 levels of cognition. The first one is conscious thoughts, which are rational thoughts and choices that are made with full awareness. The next one is automatic thoughts, thoughts that flow rapidly, so you might not be fully aware of them. This may mean that you can't check on them for accuracy or relevance. In a person with a mental health problem, these thoughts may not be logical. The last one is schemas, which are core beliefs and personal rules for processing information. Schemas are shaped by influences in childhood and other life experiences. So, aside from CBT, which is the best form of treatment around, what else can you do to treat a case of hypochondria? Well, there are some strategies you could try, which are keeping yourself occupied with other tasks so that you don't have time to think about any potential illnesses. This is a really good one because you could go for a walk, you could cook some food, or maybe even play a musical instrument. The second thing you could do is avoiding areas with mirrors when possible, as to not habitually check for any symptoms of an illness. The last thing you could do is meditate to relieve anxiety, as when you're thinking about something other than your health, it'll definitely take your mind away from any sort of disease-related anxieties. Now that we know what kind of treatment Mr. James is likely getting, how would you, yes you, an ordinary person, go about interacting with someone like him? For starters, do not by any means tell them if you are sick. This will likely end your conversation and is pretty much like telling someone you have COVID after drinking from their water bottle and not fountaining it. Additionally, don't try to self-diagnose them. You might think you're a genius or something, but unless you have that MD, don't, because you might cause the person a heart attack, or at least make them think they have one if they're a hypochondriac. Also, avoid any jokes about appearance or sickness. Alright, so now that you know what it's like to have hypochondria and how to deal with someone with this condition, how would someone like James affect the people around him? Well, James lives with his parents and has a girlfriend named Elizabeth who he liked because of her similar name to the famous doctor, Elizabeth Blackwell. Anyways, as a child, James moved to the US and exasperated his parents with the amount of money spent on doctor's appointments. This caused them to move back to Canada as to not break their wallet, although the taxes here are pretty much equivalent to the amount they paid for the doctors. Although he did have very difficult behavior, he excelled in school due to his ability to hyperfixate and hyperfocus, but mainly kept to himself and did not go to many public places. This was due to his fear of contracting illnesses, so he did not have as many social interactions as your average teen. In his adult life, he does sometimes frustrate his girlfriend Elizabeth due to him visiting the doctor's office more than seeing her. Pretty rough for her, huh? But he also likes to talk about all sorts of medical things with her, as she's studying to get her PharmD degree, so that she can become a pharmacist. Now that is a perfect match. He also tends to talk a lot to his clients, and due to his hyperfixating ability, is extremely knowledgeable and helpful to them. Overall, a person with hypochondria would definitely tire and exasperate the people around them, but also are still very functional and intelligent members of society. Many hypochondriacs remain key parts of our history and education, such as Edgar Allan Poe, the famous short story writer and poet, Andy Warhol, a famous artist, and, to my surprise, Adolf Hitler. I'm sure you've heard of him once or twice. You know, people with hypochondria really seem to excel in the arts, which might stem from their ability to obsess and focus on certain topics. Well, I guess, except for Hitler. He got rejected from art school. Emotional damage! So in conclusion, people with hypochondria require an equal amount of respect despite the ridiculousness of some of their claims. To be honest, we all have our own weird quirks and traits that others tolerate, and hypochondria is really no different. Thank you for watching this short video documentary, and see you later, psychos!